Management of benign prostatic hyperplasia. Benign prostatic hyperplasia is a proliferative process of the cellular elements of the prostate, or voiding dysfunction resulting from prostatic enlargement and bladder outlet obstruction. BPH is a strictly age-related phenomenon, in nearly all men and begins at approximately 40 years of age. Its prevalence rate in Indian male population is approximately 93%. Bladder outlet obstruction in men with BPH is attributed to static obstruction, which is due to bulk enlargement of the prostate encroaching upon the prostatic urethra and bladder outlet, and dynamic obstruction, which is related to the tension of prostate smooth muscle. BPH manifests as lower urinary tract symptoms including hesitancy, straining, weak urine flow, prolonged voiding, partial or complete urinary retention, overflow incontinence, frequency, urgency with urgent continence, nocturia, and painful urination. An appropriate diagnosis of BPH can be made using International Prostate Symptom Score questionnaire, to quantify symptoms based on their severity. An IPSS score of 0 to 7 corresponds to mild symptoms, a score of 8 to 19 indicates moderate symptoms, and a score of 20 to 35 is suggestive of severe symptoms. Prostate-specific antigen test may be used to decide the most appropriate therapy. Pharmacotherapy is widely used for the management of BPH. Medications for the treatment of BPH are alpha blockers, 5-alpha reductase inhibitors, and phosphodiesterase type 5 inhibitors. These can be used in monotherapy or in combination. Alpha blockers and 5-alpha reductase inhibitors are used in combination due to their different modes of action. The alpha blockers block the smooth muscle receptors in the prostate and allow for easier, stronger flow and a more complete emptying. The 5-alpha reductase inhibitors prevent the conversion of testosterone to dihydrotestosterone, the key hormone responsible for stimulating growth of the cells and glands within the prostate. The efficacy of tamsulosin, an alpha blocker, and dutasteride, a 5-alpha reductase inhibitor in improving lower urinary tract symptoms in men with BPH was established in the COMBAT trial. Their combination in patients with mild to moderate symptoms of BPH resulted in superior reduction in relative risk of clinical progression of BPH, considerably greater symptom reduction, in comparison to their monotherapies. Their combination also led to increased quality of life, higher Qmax, and decreased risk of acute urinary retention. These results support the use of dutasteride and tamsulosin in combination for the management of patients with BPH.